progress we're making against COVID. We are now more than a year into the pandemic, which seems like a dog year when you think about everything that's happened this past year. But the good news is we really have never been more hopeful and more optimistic than where we are right now. So it is nice that we've been fighting against this virus for a long time, and we've had some weapons here over the last 7 or 8 weeks that we're seeing making some really good progress with. Specifically, recognition of the dangers of the virus, but with the increase with vaccines, we're just really seeing a lot of good things taking place. More and more people are getting vaccinated. The vaccination sites around the city, including LouVax, which is run by our public health department, Broadbent, community outreach sites, pop-up sites, hospital-based sites, opening up Tier 1C to more appointments. Just a lot of really, really positive things taking place now in this fight against COVID-19. Announcements from the White House. President Biden has said that vaccine supplies will be sufficient to make it possible, if we all do this right, to see enough vaccination taking place in our country that small groups maybe can get together and to celebrate Independence Day together on July 4th. So I know that's a great vision for so many of us that miss our family and friend gatherings. Then last week, a huge bump to our efforts here with the passage of the American Rescue Plan. Provides a lot more resources to help us eliminate COVID-19, and then also gives us financial weapons to make sure the people that have been struggling economically and businesses that have been struggling also have got assistance now to help them get through this phase of the pandemic in a powerful and equitable way. So that's lots of good news, but we've got to stay focused because we know what we've seen throughout all this, that the virus can mutate. It's trying to defeat us while we're trying to defeat it. So we got to stay humble to the virus. And then, of course, we've got to work together to get through any phase of this particular challenge. And boy, we've seen that from our public health professionals. I want to thank our Department of Public Health and Wellness and the wonderful job they've been doing, to our hospital partners, business partners, nonprofits, community-based organizations, schools, volunteers, et cetera. That's how we're really getting big things done throughout this virus. And that's how we're going to turn this crisis into an opportunity. And so when we take a look back on this, we'll see we rose to the occasion, and we're really making historic progress right now. But there's a long way to go. There always is, no matter what the challenge is, but particularly on one as big as this challenge right now. So let's take a look at the current state of where we're at right now, and we'll do that with our Director of Public Health and Wellness and our city's Chief Health Strategist, Dr. Sarah Moyer, is going to take us through our public-facing data on our website here. Dr. Moyer, welcome.
Thanks, Mayor. So, great news to report that we are in our 9th week of declining cases here in Jefferson County, with 867 cases added last week. And we are still in the orange, so headed in the right direction. If you scroll down a little bit more, you can see that the trend there is starting to level off a little bit. So just a few reminders. This week, we know that spring break's coming up. The community is opening up more, which is all really positive with the number of vaccines we have going out. But if you are planning to travel for spring break or planning travel in particular, just please make sure you're getting tested 1 to 3 days before you leave. If you are a JCPS family, they now have testing sites associated with that anyone can get tested with. If not, we have plenty of availability in our community testing sites. So please start planning ahead for that. If you are traveling, get tested 1 to 3 days before and 3 to 5 days afterwards. We want to make sure we catch all of our cases. And going down on our death trend, you see it's starting to trend down. We know the last 2 weeks are not accurate yet, so look past there into February, and then 22 deaths are added this past week, and so starting to trend down to where we were in September, October, with deaths as well. For vaccinations, we had another record-breaking week last week for the number of vaccines given in Jefferson County. In total, our Jefferson County providers have given out 290,846 doses of vaccine, and 29.6 thousand of those went to into arms for the first dose last week, and 11.3 were second doses. So in total now, 178 1,426 Jefferson County residents have been fully vaccinated. And we are just hoping for the day where that number is 700,000, when we have more than our entire community vaccinated. And then we've cleaned up the website a little bit. So if you want to click on the maps, that's down farther. Our hospitalization patients are at record lows for our winter as well. 116 people in the hospital, which is the lowest since September. And so just good news with that as well. And same with ICU and ventilators are trending down. And then the maps there, if you want to dive into that, we've added the death rate per 100,000, so you can see which zip codes have had a higher rate of death from COVID over the last year, as well as those incident maps, and zip code without long-term care are also on the website still. And then diving in what's behind the numbers with our demographic data, you see there that it continues to be more white people are getting infected with COVID and are having higher death rates here in Jefferson County, which was different than the beginning of the pandemic. And age category is still our older populations. We've gotten more and more 60 and 70 plus year olds getting vaccinated. So just another reminder that we are trying to get everyone over the age of 60 vaccinated. So if you have any friends or family members, neighbors that have not signed up yet, please have them look at our vaccine website and look for appointments. Most of the providers add appointments on Thursdays and Fridays. If there's not anything available, please put your name on the Norton wait list, and we try to get through some of those at the LUVAC site and into other places as appointments open up. For our demographics for our vaccinated patient population, you see there that more white people have gotten vaccinated so far in Jefferson County, and we continue to work with our partners to improve that and to make sure everyone has access and ability to get vaccinated. And you see that we a higher percentage of people over 60 and 70 have gotten vaccinated, and that is intentional as we try to get our older populations vaccinated first, as they tend to have higher morbidity and mortality from COVID. And yeah, so just a reminder there on the website, if you need a testing location, you click there, and great information about contact tracing, how to contact our contact tracers. We are still doing that, and so please remember to answer your phone if you do test positive. My team is there with you to help explain COVID and to make sure you have the resources you need to follow all of our great public health guidance and staying home. So thank you with that, and enjoy this nice spring weather.
Thank you, Dr. Moyer. Before we go away, let's talk a little bit more about our equity efforts and focused activity to make sure that the vaccine's available in our Black and Brown communities. So could you share some of our major efforts on that, please?
Sure. We are partnering with all of our partners who have vaccines. So our healthcare systems, U of L and Norton in particular, are doing outreach events at a lot of churches across the community. Those are getting scheduled slowly, but are getting scheduled so we can reach populations that maybe can't access or are not able to schedule through our hospital numbers. And thank you for that slide as well, too. Encourage everyone who can to sign up online for a vaccine appointment. If you do not have internet access, there's numbers here that you can call to schedule an appointment as well too. So the helpline, which is the same if you test positive for COVID, but our staff are now trained to answer vaccine questions and help direct you and get you signed up for vaccinations as well, along with Norton and Walgreens and CVS, which all have excess vaccine, can also help you get scheduled there as well too. And you can see those numbers online to get vaccinated. We're also reaching out to our populations that maybe can't travel to the LUVAC site, vaccinating our putting plans in place to vaccinate our homebound, our senior centers, as well as our homeless shelters and other congregate living that maybe cannot travel to vaccine sites. And so all that is ramping up this month, and hopefully we will be able to have access to vaccine for everyone who is willing.
Okay, thanks very much on that. We're making good progress with our churches in West End and other black churches, predominantly black churches, in terms of vaccination events on site. Some of the smaller churches coming together to aggregate that. So we welcome that type of demand from the public, so that we can coordinate events with our hospital systems to make sure we're getting as many vaccines to as many people as we can. So thank you, Dr. Moore, for all your help in that area. Now, when you step back and take a look at the increase in vaccines we've got, more than 20% of Louisvillians have now received at least one dose of vaccine, and that number is growing every day. And as people are completing that cycle, they want to know what their options are, just like people that have had the virus also want to know. So the CDC recently issued some guidelines, updated guidelines for people who have been vaccinated. Excuse me. So let's talk about those updated guidelines and the latest research on that subject with Dr. Mark Burns. Dr. Burns, who you'll recognize, he's a frequent guest on this call, is an infectious disease specialist and an associate professor at the U of L School of Medicine. So welcome back, Dr. Burns.
Thank you, Mayor. Thanks for having me.
Lots of changes going on, and we can always count on you to be on top of each and every one of them, it seems like, by the latest minute. So what can you share with us what the latest guidelines are from the CDC? And for folks that have been fully vaccinated in particular, we're getting more and more questions about that.
Okay. Well, Mayor, as most Americans are vaccinated, a growing body of evidence now tells us that there are some activities that fully vaccinated people can resume at low risk to themselves. The CDC has determined that for fully vaccinated people, the benefits of reducing social isolation and relaxing quarantine requirements outweigh the risk of people becoming ill with COVID-19 or transmitting COVID-19. Also, by taking steps to relax certain measures for vaccinated persons, they also feel that this may improve COVID-19 vaccine acceptance and uptake by more people. The CDC has laid out some activities that they consider safe for those that are fully vaccinated. Now, fully vaccinated means 2 weeks after their second dose of either the Pfizer or Moderna vaccines, or 2 weeks after receiving the one-dose Johnson & Johnson vaccine. The CDC makes clear that this initial guidance, and as more people get vaccinated and the science and evidence of COVID-19 expands, along with our increasing understanding of the virus, these recommendations may be updated from time to time. Now, these present recommendations I'm about to tell you, these are recommendations that focus on activities that fully vaccinated people can perform in a private setting, such as their home. And here are a few scenarios. I've got this illustration. This is from the CDC website, and I'll kind of go through, hopefully, to explain this clearly. Now, first, fully vaccinated people can visit with other fully vaccinated people in small gatherings without wearing masks or social distancing. Now, Dr. Walensky of the CDC says that, for example, you and a friend or you and a family member that is fully vaccinated can have dinner together, not wearing masks or social distancing. Or you can visit grandparents if both you and your grandparents have been fully vaccinated. Now, another scenario that's a little bit more complicated involves vaccinated people visiting with unvaccinated people. The underlying risk here is to the unvaccinated persons or people in their household. So that's what we have to keep in mind and take in consideration. So fully vaccinated people can visit with unvaccinated people if one other household, well, first of all, they can visit one other household indoors without wearing masks or physical distancing, as long as the unvaccinated people or any unvaccinated members of their household are not at risk for severe COVID infection. And severe COVID infection basically means someone who's over 65, someone that may be pregnant, someone that may have underlying heart disease, cancer, sickle cell, any of these conditions that would put them at high risk for severe COVID infection if they were to acquire it. Now, example of this would be vaccinated grandparents can visit with their unvaccinated daughter and children as long as they are not at high risk for severe COVID disease. Now, another example is a fully vaccinated person visiting with an unvaccinated person or with unvaccinated people in a household who are at high risk this time for severe COVID-19 disease. In that particular scenario, everyone, regardless of the vaccine status, has to wear a mask, be socially distant, and preferably be outdoors or in a well-ventilated room and practice good hygiene. This recommendation is to help keep individuals of high risk to keep them safe. Similarly, when vaccinated people are visiting with unvaccinated people of multiple households, everyone, regardless of the vaccine status, has to wear a mask, has to be social distant, and preferably this activity would be outside or in a well-ventilated room, and they practice good hand hygiene. So to really summarize, you can wear a mask indoors with other fully vaccinated people without wearing a mask. Or you can gather indoors with unvaccinated people from one other household, for example, visiting relatives who all live together. You can do this without a mask unless any of those people or anyone living with them has an increased risk for severe COVID-19. Now, one other activity that the CDC did mention, they said if you're fully vaccinated and you've been exposed to someone who has COVID-19, the fully vaccinated person does not need to quarantine or get tested unless they have symptoms. Now, they did give a caveat to that. They said if you live in a group home or a group setting like a correctional or detention facility or a group home, and you're around someone that has COVID-19, in that particular case, however, you do have to still stay away or quarantine for 14 days, and you have to get tested even if you don't have symptoms. But again, that's the only caveat to that. So that's all we have as far as new recommendations.
Okay, well, that's a lot to take in, and but a lot of progress at the same time, and we'll have more and more as each day goes on. So we appreciate that, and I know there'll be more questions for you, Dr. Burns, from the media, if you could hang with us here for a little while.
Certainly.
All right. Now, as more and more people are getting vaccinated, we're seeing more and more positive signs, and businesses can now open to 60% capacity, and people want to have more and more events, and we're seeing more and more events being scheduled for the spring and summer. But as we've seen before, it's really important to balance the opening with the businesses for the sake of the economy, because we don't want this to spike up again. And we are seeing that in some other places around the world. So we got to exercise caution here as we balance opening up the economy and making sure the virus is kept at bay so we don't see another spike here in the community. So that's the task of our public health and wellness team, to strike that balance. And now I'd like to welcome back Nick Hart. He's the Assistant Director of Public Health who leads our compliance response. Nick, you've had a tough job here over the last, you've always had a tough job, but it's been particularly tough over the last 9 to 12 months or so. So tell us what you're learning and what is it that businesses need to know now?
Thank you, Mayor Fisher, and I appreciate that. Our team has definitely worked incredibly hard to balance the interests of businesses and the interest of our residents and to make sure that we all stay healthy. You know, when it comes down to the big story, there's three big things, right? It's, reinvesting in COVID precautions, it's getting vaccinated when it's your turn, and it's really taking the extra effort to understand what the new changes are. So what's nice is that not a lot has changed for a lot of our businesses. What we do need to be careful about is, number one, burnout. We've got to be encouraging, our teams and our staff. But again, not much has changed. So we still know that, the infection settings are still similar to what they were in the past. Indoors, close contact. What we have to remember as the weather warms up is that outdoor infection can still spread with close contact. And we've got the new variants. And so I'm sure people have heard the race against the variants. That all takes into that consideration of taking the next step as well. So, like I said, getting vaccinated when it's your turn. I've heard a lot of the comments of other people are more deserving or need it more. When it's your turn, we want people to step up and get their vaccine. And so for businesses, what that might include is providing an incentive to your staff members who do get vaccinated, just like we're hearing from Dr. Burns with some of the loosening of the gathering restrictions. And then when people do get vaccinated, go back, reinvest in some of that guidance that we've been discussing and practicing for a year. We talked about quarantine. Remember, quarantine is about an exposure. If people are actually sick, they still need to isolate. So regardless whether or not they've been vaccinated. So remember, quarantine is exposure. Isolation is when someone's sick or positive with COVID-19. So even though we can relax some of those safeguards at home, we cannot relax those safeguards in the public and at places where we work.
So people are starting to think more about, getting back, quote, to normal. And, part of that sporting events and festivals, concerts, that type of thing. So what are we looking at in terms of being able to get back together again?
Yeah, that's a great question. And, we're approaching the end, which is great, but we're still in our approach to that end. So, I talked about businesses reinvesting. I want to make sure that, our neighbors and our family members are also reinvesting. And so what's nice is not much guidance has changed. We can still go to the Healthy at Work and the Team Kentucky web pages and find that guidance. We have had some changes in increase of capacity, up to 60% of capacity for most of our restaurants. But that also is the same thing for those events and any venues that we might visit for sports or outdoor activities. And the other thing that's still in place is our face covering executive order, right? So when we are gathering, we still need to wear those face coverings. So that gets me to the topic that I always talk to everyone about, is our 5 prevention methods, right? If you're high risk, you need to take extra precautions and still delay some of your phased going back out into the public, right? If you're sick, we still want you to stay home. We want people, even though they're going to go outside into places where groups are, avoid those groups by practicing and maintaining distancing like we've done, right? And when you can't avoid the groups, continue to wear that face covering. And then, I love this. I've been saying 5 preventative measures for a year. And I get to say 6 preventative measures now, right? Because the next one is get vaccinated when it's your turn. The governor's team has shown us a really good example of phased reopenings. We invested in a lot into getting schools opened. And so we also want to make sure we're measuring our risk and deciding what's important for us, and kind of what Dr. Burns talked about earlier is that we can mitigate more damage by allowing some gathering while still practicing safeguards. So I do want to remind everybody, it's like that old adage, most car accidents happen within 2 miles of home, right? So that we're in that same scenario. So keep paying attention, keep your guard up, keep being aware and weighing those risks.
Perfect. Okay. And now tomorrow, St. Patrick's Day. What do you expect? Obviously, people want to get together on St. Patrick's Day, but I know we're going to be out enforcing compliance. And look, everybody enjoys St. Patrick's Day, but we want you to be able to enjoy next year's St. Patrick's Day as well. So talk a little bit about our compliance activity tomorrow and what we're prepared to do.
Yeah, absolutely. So we've had some great examples being led by our community already, and delaying some events and adjusting celebrations for St. Patrick's Day. The restaurants and bars creating that passport booklet of going out and seeing places. That's a wonderful example, because what they're doing is reducing the opportunity to crowd in large numbers. I will say that we started a couple of weeks ago at LMPHW reaching out to those venues that we know historically have large gatherings, and did the same thing. hey, we know that you have a big day coming up, want to make sure that you're still practicing those precautions, and provided that coaching, provided the updates to the Healthy at Work. And so here, when we're approaching St. Patrick's Day, please, everyone, remember, stay home if you're sick. When you go out into these groups, keep your distance when you're not seated. Make sure you have a seat. Don't wander around establishments. And if you're moving from one place to another, you still are required to have your face covering. We will have team members out tomorrow, going back out to the facilities that we've already reached out to. We are partnering with ABC. So if we do observe violations of Healthy at Work, and this is no different from everybody, remember we've been doing this for a year, we will approach the establishment. We will issue corrective orders if we have to. That may include a fine. And if, we would like to see those corrective orders go into action immediately. And if we don't, we have had those same venues for correcting those issues that we have in the past. We look at permits. ABC comes out and looks at liquor licenses. We had gatherings this weekend, and we did not have anything that was out of the norm. Saw lots of compliance. We did not see a big variance to what we're used to seeing. So I'm happy to communicate that.
Great. Okay. Well, so let's just focus on safety tomorrow. St. Patrick's, everybody wants to be Irish for a day, but focus on safety tomorrow. Okay. Thank you, Nick. And Jess, we'll go back to you for the questions, and I've got to drop off the call right now, and we'll leave it to you and Dr. Moyer to take it from here.
Okay. Thank you, Mayor. Okay, Dr. Moyer, we have several questions in the chat from media about spring break. The first question comes from Jonathan Gregg with Spectrum News. He says, how concerned is the Metro Health Department regarding spring break travel?
So anything that increases the number of people you have come in contact with is higher risk. So we saw increases of COVID after July 4th last year, after fall break, after Thanksgiving. And so spring break falls into that same category. I think we're in a little bit different position now because we have a vaccine, and so less anxious about those that are traveling that are vaccinated, but we still have 80% of our community that is not vaccinated yet, including all of our kids. So we are concerned. So the next best thing, if you're not vaccinated, is testing. And so just encouraging everyone to get tested before they travel, and then when they return. So if they do happen to get coronavirus while they are on their vacation enjoying themselves, we find out about it early, and we stop that chain of transmission so we don't have a huge spike. We might have a 1 week increase in cases, and those die off, and that's the best thing we could hope for. So encourage, if you're not vaccinated, try to make it a stay-at-home week, and then if you are, try to make your travel lower risk. So if you're going to the beach, staying in your own bubble, having your meals inside still is a lot less risky than if you're going to Florida and going to all the bars and restaurants and pretending life is back to pre-pandemic. So there's a lot of ways to reduce that. And so hoping that people choose to do that, and we'll see what happens afterwards.
And a follow-up to that from Sarah Ladd with the Courier-Journal. She asks, have we seen a rush of Louisvillians headed to Destin and other Florida points for spring break? Is there a risk of another spike because of this? If so.
Yeah, anytime we have people mixing that haven't, there is an increase. There's a risk of increase in cases. And so just as long as people get tested before they go and aren't traveling if they're sick and don't have COVID, hopefully they're not bringing it back. So just another emphasis on that testing, and hopefully people choose to do that.
Thank you. And our next question is for Nick Hart. Sarah Ladd with the Courier-Journal says, will police play any role in enforcement or monitoring of St. Patrick's Day gatherings in bars and restaurants? Does the inspection and enforcement team anticipate any issues?
No, we've had a good relationship with LMPD. We've reached out to them in the past and created those networks to be able to coordinate when we have large events. LMPD has always really been prepared for St. Patrick's Day. That doesn't change what they're doing. and now they have better access to us if they need guidance. And our primary partner when approaching a business is really through that business licensing, through food licensing and liquor licensing with ABC. So we prepared to have those conversations, exchange numbers. We'll know we know who's going to be out tomorrow from both groups. So if we do see an issue, we can teamwork that. And then we did not see any big issues over the weekend. I'm looking here at kind of some of our compliance review, and we were out through the Friday and over the weekend, and I do not see much enforcement activity. So, and I checked in also with some of our other partners at EMA, and they also did not observe crowds and large gathering issues. So, not saying we couldn't have missed something, but nothing large was on our radar.
And just a quick
thanks.
reminder with that, Jessica, sorry I didn't jump in, that a lot of our activities are complaint based. And so a reminder, if people are out and they're seeing people gathering, seeing people without masks on, please make sure you're calling Metro 311. And so we are aware of it. We do not have the staff and team to be out and about everywhere. So really relying on you all in the public to let us know if you are seeing something that is not following the Healthy at Work recommendations.
And Sarah Ladd has a follow-up, Nick. She says, regarding those phone calls to venues Mr. Hart mentioned, were the reminders well received?
Generally, I mean, I have no reason to believe that they were not. We have a very good working relationship with all of our food service facilities and our drink establishment facilities. You got to remember, we're generally into these places 2 times a year. Every year, they're having to renew their permits on an annual basis. Any changes that they do or modifications to their facility, we also review. So I did not hear anything come up. So I'm going to assume that they were well received. And I will look into why enforcement data has not been posted for this week and try to get that up as soon as possible.
Okay, thanks, Nick. And I do not see any other questions in the chat. So Dr. Moyer, do you want to close us out for today?
I'm going to turn it over to Dr. Burns and see if he has any last minute closing thoughts for us as we head into warmer weather and more vaccinated people.
Okay, yeah, the only thing I really have to add is that we are going in the right direction here in Louisville and Jefferson County. Nationwide, there seems to be somewhat of an early plateau. That's kind of concerning for another potential spike, given, as Dr. Moore has mentioned, spring break activities that can come about. However, I think we all still need to really, really be diligent about this. The only other thing I would say is that the virus in and of itself doesn't care what color you are, what your political affiliation is. It's out to ravish us all, and we all need to continue to fight strong. Get vaccines when they're offered to you. Continue the public health mitigating measures. Do these things so we can we can crush this virus and get everything behind us and get back to normal. So that would be my only thing I would add.
And we have one additional question in the chat. This is from Stefan Johnson with News. He asks, could someone address the need for volunteers at the Louvax location? How many volunteers are needed? Have signed up, qualifications in any other locations where volunteers are needed?
So for the Louvax site, we are still looking for volunteers. I believe, I don't have the numbers in front of me, but over 6,000 people have signed up to be volunteers. Not all have volunteered yet. The number of people, how quickly those shifts are going has started to slow. And so if you've tried to sign up in the past and weren't able to, recommend you look at that again. New shifts get posted every Friday. So just encourage anyone who has time, clinical or not. We have both roles, just encouraging everyone in the community to come up and sign up for helping us out at the Louvax site. So appreciate the community effort that's going into getting our community vaccinated, and thank everyone for doing that for us. And I am not sure about other volunteer opportunities with other agencies across the community. Thank you to Kathy for posting the volunteer sign-up center.
Okay, that is the last question in the chat.
All right, thanks everyone. Don't forget your mask, your spacing, and get vaccinated when it's your turn.